Hello, this is Dr. Rajni Mandal with Pathology Watch, here with your 3D 3-minute digital dermatopathology digest. Today's topic is pilomatricoma. Pilomatricomas are benign cysts which are most commonly seen in children in the head and neck region. The originating cell of pilomatricomas are the hair matrix cell. Here is a terminal hair follicle with an outer root sheath, inner root sheath, and matrix. A somatic mutation of the CTNNB1 gene in a hair matrix cell leads to pilomatricoma due to increased beta-catenin production, decreased cell adhesion, and uncontrolled cell division through the Wnt signaling pathway. Here is a fragment of a pilomatricoma. You can see here that the cyst lining has the same color and quality as the hair matrix. The cyst lining of a pilomatricoma undergoes keratinization without formation of a granular layer. The keratin in the center of a pilomatricoma is quite characteristic. You can see here multiple holes. These are the ghosts or shadows of keratinocyte nuclei as they mature to form this keratin. Pilomatricomas can sometimes undergo a granulomatous reaction when they rupture. Here is a ruptured pilomatricoma. You can see here there is no characteristic cyst lining. This pink material in the center are fragments of keratin. The keratin has the characteristic holes known as ghost or shadow cells, characteristic of a pilomatricoma. The surrounding area is granulomatous inflammation with multinucleated giant cells, and sometimes you can see keratin within the cytoplasm of the giant cells. Here are your 5 flashbacks for today. Pilomatricoma is most common in children in the head and neck region. It's due to a somatic mutation of CTNNB1 gene in the hair matrix cell, which leads to increased beta-catenin, decreased cell adhesion, and uncontrolled cell division through the Wnt signaling pathway. It is a cyst with lining of hair matrix cells, also known as matrical cells, and is filled with keratin with ghost or shadow cells. A granulomatous reaction is very common, and they can calcify, giving them the pseudonym calcifying epithelioma of Malherbe. They can also ossify. Multiple lesions are seen in myotonic dystrophy. Here's your review question for today. A patient is undergoing an excision of a recurrent pilomatricoma. What histological features would not suggest a worrisome outcome? A. Increased mitotic activity. B. Ossification. C. Central necrosis. Or D. Infiltration of the subcutis. The answer is B. Ossification, which can happen in benign, long-standing pilomatricomas. The other findings are seen in pilomatrical carcinoma. That's it for me for today. This is Dr. Rajni Mandal from Pathology Watch, revolutionizing pathology for dermatologists. Check us out at pathologywatch.com.